Catholic Medical Center's Dr. Stephen Hanlon says for IV drug users, a heart valve infection known as endocarditis can be caused by sharing needles or not cleaning skin before drug use.
Basically injecting bacteria into their skin, it lodges on their valves and the valves get infected.
Dr. Hanlon says damage to the heart valve can cause symptoms such as chest pain, shortness of breath, and fever.
The symptoms can be very vague, and a lot of people initially think that they just have the flu.
He says some cases can be treated with antibiotics, but others need surgery, which can be costly.
And then an artificial valve needs to be put in, which unfortunately increases the risk of subsequent episodes.
The number of patients coming in with opioid-related endocarditis is on the rise. In 2011, there was one reported surgery at CMC, and last year, there were 16.
A lot of our patients who have had their valves replaced have come back, unfortunately.
And that's because continued drug use can cause another infection. But now the hospital is taking steps to address the needs of these types of patients.
A committee was formed of ethicists as well as a cardiologist and a social worker, just to really look at the whole issue and develop guidelines.
Patients will work with a social worker to develop a plan for recovery with the goal of improving the outcome of their surgery in addition to their health.
It's one of those moments where they may not have thought about sobriety, but given the seriousness of this disease, that maybe it's an opportunity.
The committee was formed 6 months ago. Staff are actively using new guidelines, and they are in the process of forming a team to meet with these patients to make sure they are introduced to the services that they need. Live in studio, Kristen Carosa, WMUR News 9.